state reaching a whole new level of anti-vaccine insanity. The lead starts right now. With young and unvaccinated people fueling this new explosion in COVID cases, the government of the state of Tennessee caves to anti-vaxxers and ditches all vaccine outreach to kids, not just for the COVID vaccine. How deadly might this ascientific move prove to be? A ticket out as the Taliban hunts them down. President Biden gives a timetable for beginning to get Afghan allies who help the U.S. military safely away from Taliban guns. Okay, but when? When will the flights begin, and what's the actual plan? Plus, backpacks, notebooks, new kicks, lunches. Boy, back to school season could have parents paying more and punching the air. Welcome to the Lead. I'm Jake Tapper. We start today with our health lead and a surprising and dismaying move to stop all vaccine outreach to children despite the growing number of coronavirus cases among the unvaccinated. The decision made by Tennessee health officials just one day after firing their vaccine chief because she tried to promote shots for teenagers. The move coming as the COVID situation in the United States continues to get worse, not just in Tennessee, but across the country. The U.S. now averaging roughly 24,000 new cases per day. That's a 75% jump from last week and a whopping 93% spike from 2 weeks ago, while vaccination rates continue to go way down, 41% down from just last week. A big chunk of this problem is that far too many Republican leaders in the United States have decided to spew what conservative writer Jonah Goldberg calls a, quote, geyser of paranoia and asininity. They reject science, specifically the science that created the very vaccines that then President Trump helped to fund and create through Operation Warp Speed. Rejecting these vaccines is sadly, tragically, becoming a Republican policy position, even though 99.5% of the people dying of COVID in the United States, 99.5% are unvaccinated. The White House's solution, such as it is to battle the misinformation about vaccines with a PR blitz, one that today included a pop star's appearance in the briefing room. CNN's Erica Hill gets us started.
The White House calling in pop star Olivia Rodrigo.
It doesn't matter if you've got the company, get the vaccines about protecting yourself, your friends, and your family. Let's get vaccinated.
In an effort to boost vaccinations, especially among teens and young adults, as misinformation and politics threaten to derail vaccine progress.
It's pretty clear who they're listening to, and it's not the scientists.
After sharing information on Tennessee's vaccine policy for minors, one of the state's medical directors was fired this week. Now, according to documents obtained by CNN, the state has ordered a halt to all vaccine outreach for kids.
It is any kind of outreach around the importance of vaccines for children, around the importance of COVID-19 vaccine for adolescents especially, has been halted, even going so far as to cancel events that are scheduled well into the fall for flu vaccination within schools.
The American Academy of Pediatrics calling her firing the most recent example of politicizing public health expertise.
What we'll see, and the ones who will also pay the price other than the unvaccinated adolescents, are the little kids who depend on the adults and adolescents to get vaccinated in order to slow or halt transmission.
In Mississippi, which has one of the lowest vaccination rates in the country, 7 children are in the ICU with COVID, 2 are on ventilators.
We're too often falling back onto human behavior, thinking that people will do what's in the best interest of the most, but that hasn't been proven to be true so far.
Hospitalizations skyrocket in several states with one common thread.
The people who are being hospitalized are those who are unvaccinated, and we think that that's come with a lot of the unmasking.
They're also younger. South Florida seeing a surge in patients in their 30s and 40s. Meantime, the more contagious Delta variant now accounts for nearly 60% of new infections in the U.S. Nationwide, all but 4 states seeing a jump in new cases over the past week.
The Delta variant and the Delta Plus variant are here in Louisiana. It is real, and it is very frightening.
Jake, that is the message that we're hearing from officials across the country, including here in New York City, where we're told it is that Delta variant that is fueling a new rise in cases in the city. We also learned today that from January to June, new cases, hospitalizations, and deaths in the city, nearly all of those were among the unvaccinated. And this comes on the same day that the CDC is updating its ensemble forecast, predicting hospitalizations are likely to rise in the coming weeks, and this is after months of decline. Jake?
All right, Erica Hill, thank you so much. Let's go to Tennessee now. Let's talk to the chairman of the Nashville COVID-19 Task Force, Dr. Alex Jahangir. Thank you so much for joining us. Were you consulted at all about this change in the guidance on vaccinations for adolescents? And what do you make of what's going on in your state?
Well, good afternoon. Thanks for having me. You know, here in Tennessee, the Nashville Metro Health Department is independent of the state health department. So no, we were not consulted regarding this. And frankly, what the state is doing doesn't impact what we're doing here in Nashville. In fact, here in Nashville, we believe that vaccination is critical right before school starts. There are required vaccinations for kindergartners and 7th graders. And so we are very actively pursuing vaccinating everyone. In fact, we have a vaccine drive at a local school, and we'll have a drive every day for this next 2 weeks at local schools, because vaccinations is extremely critical, and that's the best way we're going to keep you from getting sick. So that's where we stand.
Well, that's great for the citizens of Nashville and that county, but what about the rest of your state? Are you not concerned as a physician that the decision to fire the vaccine director, to stop outreach about the COVID vaccine to minors and to teenagers, and also to stop outreach when it comes to just other vaccines, that this is going to lead to a spike in COVID cases in Tennessee and other preventable illnesses and diseases?
Well, yes, of course I'm worried. I think the science has shown for decades now. You know, we don't see rubella, measles, and so forth in schools and kids. We have healthy children in America. And the reason we have that is there has been a robust immunization program now for multiple decades. So I think the best way to save millions of Tennesseans is to encourage vaccinations, make it easy, and not buy into any rhetoric that vaccinations are problematic or there's anything bad about them. I think the politicization of vaccinations can truly have a really negative impact on Tennesseans and people around the U.S. So yes, I am concerned as a physician and as somebody who leads a local health department here in Tennessee.
So I guess what's happening? I mean, is there a pro-polio lobby in Tennessee? Why would anybody make these decisions? I admit I'm biased. My dad's a pediatrician. I believe that immunizing children and saving their lives is a good idea. That's my bias. Who's running your state? What's leading them to make these decisions?
Well, you know, that's a question I can't fully answer. I know the politicization of vaccines seems to be a relatively new trend, because vaccinations in my both adult and child life have never been political, right? And so we need to not politicize vaccines. We need to let science drive decisions. We need to make sure that the people and the children of Tennessee grow up healthy. And so there's some great people working in the Tennessee Department of Health. I know a lot of them. And I think it's really important to let these professionals do their job in a way that doesn't politicize the great work that they're doing.
All right, Dr. Alex Jahangir, thank you so much for what you do, and thanks for talking to us today. Appreciate it. Let's go to CNN's chief medical correspondent, Dr. Sanjay Gupta now. Sanjay, what concerns you the most about what the government of Tennessee is doing in terms of no longer encouraging outreach when it comes to the COVID vaccination for teens or vaccinations in general to minors?
It's a clear sort of politicalization of a very sacred part of public health. I mean, we've seen this before. I've been reporting on these types of things before. Even before COVID, you remember there were measles outbreaks in various places around the country. This is a clear politicalization of it. I think that's the bad news. The good news, I think, what Dr. Jahangir was sort of alluding to is that, you know, Tennessee in 2020, 2021, we're doing pretty well with regard to pediatric and adolescent vaccinations. But now, you know, will this lack of postcards going out to remind people of second doses, outreach programs to remind people to get some of these pediatric vaccinations. Will it make a difference? Will people still go ahead and get vaccinated, you know, despite this politicalization? I hope so. I think that's the hope. I mean, we saw this throughout the pandemic, right, Jake? I mean, there would be no mask mandates would be lifted and people would still wear masks in some of these places. So now it's becoming a question of, will people still do the right thing despite the obvious, very clear politicalization now of these sacred public health programs?
I hope that it's worth it. I mean, all these kids that could get sick with preventable illnesses, it's a disgrace.
Yeah.
Sanjay, you have a brand new essay out this morning on the importance of being vaccinated and what it means to be unvaccinated about the coronavirus. Tell us about the essay.
Well, first of all, you know, we talk about this race often, Jake, the vaccines versus the variants, and you know, I've been following it closely. To be fair, we were very close to sort of crossing the finish line of how public health experts define this: fewer than 10,000 cases per day. It's at that point where you feel like you can get your arms and hands around this and feel that it's contained. We got to 11,299, and the cases started to go up. They've gone up 100% roughly since last week. At the same time, vaccinations have gone down 50% since the last week. So that's the curve right now. The concern is that you're going to start to see those numbers persistently go up, and after that, as we saw this time last year, Jake, hospitalizations and deaths could follow. I can't believe I'm even saying that, given how effective these vaccines are. I think somebody told me, Barney Graham, who's a deputy director at the NIH, said the country is basically now being fractured into vaccinated and infected. It's not vaccinated and unvaccinated.
No.
This Delta variant is so contagious. People have more than 1,000-fold higher viral load if they are carrying the Delta variant in their bodies as opposed to the original strain. And as a result, they are that much more contagious, Jake. Casual encounters, even just walking by somebody, sharing airspace a few meters away, can be enough for transmission. So I'm worried, Jake. I mean, you know, I did not think we'd be having this discussion at this point about the pandemic.
Dr. Sanjay Gupta, thank you so much. I appreciate it, and I share your concern. The Select Committee in Congress just announced a date for its first hearing on the January 6th insurrection, but there is one glaring issue outstanding. Plus, in just moments, the hearing begins that could help decide the future of Britney Spears. Stay with us.
We've got you taken care of, Sergeant Houston.